We are in a phase in plastic surgery where we may never see this many patients successfully losing this amount of weight ever again. Because I think in the future, patients will get on these drugs earlier and they may never, gain the 100 pounds.
You just contact the company and they'll ship it out to you or your operating room. And this sounds just like what you're envisioning, but for patients out there, consumers, this is why we want to sort of have your own fat repository, because if you want fat in the future, hey, we have the fat as well as the stem cells.
Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim, and I'm here with my wonderful host, Dr. Kristy Hamilton, and we are the Beauty Scientists. What we're going to be talking about today is PSTM, Plastic Surgery, the meeting. This happened in New Orleans in October. So it's been about 3-4 weeks since we've actually had the meeting to stew over and think about the latest technological advancements and techniques. So Kristy, how have you been?
Oh God, so excited to talk to you again about after all of our travels, near and far. And I do love ASPS. I love this meeting because it's all of plastic surgery, not just aesthetic. So we get to catch up with our colleagues who do mainly reconstructive or burn or craniofacial, dealing with childhood issues, cleft palate, things like that. And I think there's a really beautiful cross-pollination of those ideas. So that's always exciting. And I always learn something new.
Yeah, I mean, it's also good, like seeing you in reality, so it's great to catch up. And I know you went to one portion of the meeting that I did not go to, so I have some questions for you. Part of the meeting is called Hot Topics, which are things that are not just hot, but also some things that are sort of like maybe not really done widely, but we think that are going to be like the standard of care soon. So one of the hot topics, of course, is Ozempic. And then Ozempic Face is the most visited web page on Dr. Franco's plastic surgeon's website, as well as we're treating skin and laxity issues for GLP-1, Ozempic. What did you get away from Hot Topics regarding this?
So a huge component of it was focused on dealing with this successful weight loss revolution that has only continued to increase, snowballing across the United States, if you will, and around the world. We are in a phase in plastic surgery where we may never see this many patients successfully losing this amount of weight ever again. Because I think in the future, patients will get on these drugs earlier and they may never, gain the 100 pounds. So now, not only are we doing a ton of body contouring surgery, tummy tucks, breast lifts, arm lifts, thigh lifts, facelifts, but we're also dealing with patients who are having more modest degrees of weight loss. So skin laxity then becomes an issue, whether it's the face, the arms, the body. And so a lot of the focus was kind of geared towards what are some of these technologies that we can utilize to enhance skin quality, maybe things outside of surgery or in addition to surgery. And what else can we do to better serve these patients? So there were some technologies that were mentioned. Softwave was one of them, which is a non-invasive form of skin tightening. Quantum kind of pioneered by Dr. Hoyos through the InMode group was another one. And we're looking at whether other addition of other peptides for helping increasing muscle tone recovery can be like paired nicely with GLP-1s as well. So that is something that I think we have to be really on top of if we're going to comprehensively serve our patients because the demand is there.
So yeah, one thing you mentioned was Aeon body contouring, harmonic liposuction, different types of technology that we're not removing fat. We're actually, in a way, trying to less surgically, still in an invasive way, tighten skin. Is that correct?
Yeah, they were some of these platforms were like, okay, it's not just liposuction, it's also all these energy modalities, like an all-in-one system. So you can be heating and tightening and doing skin improvement all at once. And then that was also paired with this whole host of other companies like Insoma Bio, Lipogenics, Lipostor, that were all about getting the best retention from your fat when you are moving it, or also how we store your own fat, which was Dr. Rubin's company. So some of these products are FDA approved, some of them are still coming down the pipeline, but now we're getting less fat out of patients. It's less abundant. And so there's more of a pressure to figure out how can we maintain the highest level of fat retention, because we all know we lose quite a bit of fat when we transfer it. So these were like gels that you could mix in with the fat and increase retention to up to 80% was what they were showing us. And so that's really interesting too. So even if we don't have a lot of fat that we can remove from somebody, we can at least make it more meaningful when we do transfer it to the face or other places.
Yeah. I mean, for those of for the viewers or listeners out there, Dr. Peter Rubin, he is chairman of plastic surgery at the University of Pittsburgh. He's one of the world leaders in fat technology, fat research, adipocytes, and you're talking about Lipostor, his company that can actually help store fat, correct?
Yeah, and they're looking at what the best way to do that. You're storing your fat, which includes your own stem cells. Maybe that will be helpful in the future. Who knows what the technology will be like? Maybe we'll be able to grow or clone your own fat for your own use down the line, or do something with those stem cells at a later date. And so, how can they preserve it in a way where you're maintaining the viability of those fat cells to the highest degree? So, that's interesting as well.
That's interesting because I ran across a company called Tissue and Cell Technologies, very boring company name. But they've been around for about 10 years. They're actually from the UK. You actually suck out fat or do liposuction, send them up to 3 liters of fat. They have preserved it up to 10 years more. It's not that expensive. It's very price competitive with what we have in terms of current technology. And the thinking is if you're a breast recon patient, yes, it's great to do, fat grafting, but if you have a secondary procedure, and a lot of them do, maybe they don't have that much fat anymore to suck out. You just contact the company and they'll ship it out to you or your operating room. And this sounds just like what you're envisioning, but for patients out there, consumers, this is why we want to sort of have your own fat repository, because if you want fat in the future, hey, we have the fat as well as the stem cells.
Yeah, and I think that's a really amazing concept, because also, like, who wants to have liposuction again just to get a little bit more fat to touch up something, or you get a little bit older and there's a little bit of volume loss. Like, if you can just have that, like your own like personal filler reserve of your own fat, that's that's fantastic, and then we don't have to go, "Oh, we're gonna save some in this area of your body for later," or we know that, like, patients may require a couple rounds, no problem. We can, like you said, like, throw away a couple extra liters of fat, and it's, like, a non-issue to have patients wait a couple months in between rounds and slowly build something. I think that's, like, a great solution. It's like a different way of addressing like the fat retention issue, right? One is like, do we mix it with the gel that like increases retention? And this is like, okay, we can still lose 50%, that's fine, but we can just kind of pull product off the shelf and add it after the fact. Great.
And so, next topic, of course, we could briefly talk about this. I guess they talked a lot about Korea during the Hot Topics presentation.
They had a whole section on international plastic surgery. And of course, the one that I thought was most fascinating, and I know we're going to do a specific episode on what you learned coming back from there, that they were talking about trends in South plastic surgery and aesthetics. The slow aging is a trend, just like it is over here. And they were saying that the aesthetic in Korea has actually moved to something like a little bit more voluptuous, like fuller breasts, not as conservative as they've been in the past in larger implants. And I think to your point, because you mentioned this before, super into skin boosters, these injections into the skin to give you the glass skin appearance. And they also love threads over there, energy devices, PDRN, or the salmon DNA one remains the most popular, is what she was saying.
Yeah. And so for the listeners and viewers out there, we will go into a very deep dive on Korean products, Korean skincare, Korean surgery in a completely different episode. I actually went to the Korea Derma 2025 conference. That's Korea's largest dermatology conference, and we'll talk about it some more. Getting back to hot topics, one of the things that you learned is something about red breasts after Alloclay and Zyrtec to treat it.
So they're saying just like we see in breast reconstruction using other tissue products like Alloderm, some of these biologic meshes that we use all the time, there can be something where the breast turns red. It's not an infection, not dangerous, but you just have to recognize it and the passage of time. And apparently, some Zyrtec will cure that. So, good to know for high volume injections of Alipay to the breast.
And then next up, of course, is a totally different topic, but rib remodeling. How long do patients actually have to wear a corset? Is it sort of customizable after they get their actual procedure?
So, this came out of the section on the hot topics in South American plastic surgery. And Dr. Alfredo Hoyos, our dear friend, gave that discussion. And so the kind of most exciting thing that's new that they've been working on down there is the rib remodeling, or where you do these like partial fractures of the ribs to narrow the waist. So it may not be that patient has like a lot of fat or like a loose core. It may be that they just have a more boxy rib cage or a longer rib cage, and you don't get to see the benefit of the negative space because of the skeleton. And so they were recommending 2 to 3 months, closer to 3 months for maximum results and nearing the waist about 8 centimeters, which is a lot.
Gotcha. So it's customizable. In other words, you could tighten it or wear the corset longer to get a more, like a bigger result, correct?
Yeah. And so it's neat, right? Because they said if you have a procedure and wear the corset for 3 weeks and then take it off, it's too soon. And then your rib cage will just kind of naturally go back to where it's used to being. So you can progressively snatch it down or cinch it up until you get to the point where you're happy, but then you still have to stay in it, even if you're not trying to narrow it anymore for closer to 12 weeks.
Very interesting. So, next topic, of course, is hot water. So, what's that got to do with traditional sauna or infrared sauna?
Yeah. So then we've kind of moved into more of the wellness space and recovery, which is, that's something we always like to do for patients, right? What can we do to make surgical recovery, laser recovery, even like non-surgical, like injectables recovery faster? And just kind of, I think that's really popular in general, people wanting to do things that are good for their overall health. So this company was making the pitch that, similar to a water bath, that's going to get your core temperature adjusted faster than and better than traditional sauna, certainly better than infrared sauna, and then pairing that with some high quality red light therapy. So they were saying go for the hot water. So I think my love of jacuzzis was well placed.
So, my concern about the hot water is, with the regular sauna, you're in there for, let's say, 15, 30 minutes, whatever. How long do they want you to be in a hot water bath, and how do they keep the water hot the whole time?
Yeah, and I think the other issue, of course, it's always like cleanliness and hygiene. Is this your own personal hot water immersion, or is this something that you're sharing with other people? So, I mean, there's a lot to be said for traditional sauna, but that was the pitch that they were making. And you'll get there faster. The temperature will get there faster. So I can't remember what they said, but I would say less time than traditional sauna. But that may not be a good thing, right? Like I know people like going in the sauna, the social experience, just taking a mental break in there. So maybe your 20 minutes is maybe we don't want to shorten that anymore.
Yeah, I mean, traditional sauna at a gym or wellness center, I mean, it works well. Hot water, I'm thinking, as a consumer, the average bathtub is not going to keep your water that hot over, let's say, 15 to 30 minutes. So then you have to rewarm it or keep the water hot somehow. And then in a wellness center or gym, it's like, depending on how OCD you are, I don't know if you want to be in a hot water bath, chlorine filtration, saltwater filtration, how many people are getting in and out of it,
Yeah.
stuff like that.
Yeah. I'm with you. I'll stick with the sauna for now.
And then anything new about red light therapy?
More devices, more technology. I've been interested in the Elixir MD device, and we're bringing that on in January. So that's more than red light even. We're going to utilize different colors and wavelengths for bacteria killing, pre-surgery, getting rid of swelling and edema. And of course, red light, we all know the benefits for anti-aging. So I think a lot more of that to come, especially with good quality, high intensity LED.
Next up with technology, of course, something we've mentioned in the past, Motiva Preserve. Anything new or maybe anything better for consumers to understand about it?
Desiree, I've been adjusting the way that I'm even describing this procedure because I do think it's so special. And I think there's a lot of confusion with regard to, okay, what is preservation breast augmentation? And then what is preserve? And then clearly there's a lot of overlap there. So I think preservation techniques that you and I both enjoy, that's we're preserving the muscle where appropriate. We're trying to disrupt and distort natural structures of the breast, nerves, ligaments, blood vessels to the least degree. So to me, preserve takes that concept and then it pushes it one step further. And what and while I think it's so cool that the recovery is also fast and the incision's like 2.5 centimeters, and you can do it away comfortably with just like a little bit of local anesthesia or a little sedation. What I've settled on for when I'm describing this procedure to patients, it's nice to have a couple less days of recovery and minimal to no pain. But more importantly is where you can place this implant and the extreme stability of it. So if you're looking at your breast and you're considering an augmentation, traditionally we make our incision in the fold, we cut our precise pocket, and you have to fill up the breast from the bottom to the top, right? And with Preserve, for women who already have volume on the bottom and the sides, we can instead go place very specifically volume exactly where they want, which is the cleavage, upper inner quadrant, selectively fill that space. It's ultra stable, and these implants just don't budge. They stay right there. Their like 3-year male data had 0% inferior malposition.
Wow, that's impressive.
Yeah, 0%. So I think that's something that you can't say with any other breast augmentation technique.
One of the phrases we both know, and I don't like it, I don't know about you, is drop and fluff. Because what happens is you create a nice pocket. You're a surgeon, you're doing a great job, but you're relying on the body to have, okay, the swelling's going to go away. It'll be a little too high right after surgery, and it's going to drop a little or appear to drop a little as the swelling goes down. With the Motiva implants, you're able to much more precisely put it where you want it to be. There's less swelling, and so it's more of what you see is what you get right after surgery.
That's correct. Yeah, I think the patients get to their final result way faster. And with the preservation techniques, like they skip that like weird boxy looking phase.
So, well, that's about all I learned from PSTM, and you definitely taught me some things and learned a lot more from Hot Topics because I didn't go and you were lucky enough to go. So, anything else to add?
No, it was a great meeting. And of course, best part is always getting to see you and catching up. And we'll do that again soon.
So, for all the viewers and listeners out there, thanks for listening to Dr. Hamilton and myself, the beauty scientist, talking about the latest plastic surgery meeting, which is held in New Orleans, October 2025. I hope that you enjoyed all these latest topics and subjects. If you have anything else you want us to talk about, please let us know. Fire away in the comments. And as always, stay beautiful.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.